Welcome. My name is Peter Strong. I am an online psychotherapist specializing in mindfulness therapy, which I teach via Skype. So if you're looking for Skype therapy for help with anxiety or depression or other emotional problems that are affecting the quality of your life, then I invite you to reach out to me. Go to my contact page and send me an email. Tell me more about yourself, what you are struggling with, what you've tried so far, and any questions you may have about Skype therapy. So Skype therapy is a really good choice for getting quality help for learning how to work with the underlying cause of your anxiety and depression. So this is different than a treatment-based approach, such as medications, which may relieve symptoms for a while, but do nothing to change the underlying process. And that's the focus of my approach, which is called Mindfulness Therapy. This is a system of psychotherapy that I have developed over the years and find to be very effective for working with anxiety and depression. People like Skype therapy because it's so convenient, and they like mindfulness-based Skype therapy because it focuses on changing the underlying causes of your anxiety and depression. So the primary underlying cause that we need to address is habitual reactive thinking. This is where we become blindly identified to ways of thinking, negative thinking, that simply reinforce and feed the anxiety and depression, very much like fuel feeds a fire. So we need to see these reactive thoughts very clearly. We need to identify them, and we need to fundamentally change our relationship to them so that they no longer operate at an habitual level. We have to take them into consciousness, which is the whole focus of mindfulness therapy. We make those thoughts more conscious, and we learn to see them as an observer instead of becoming identified with them. This is really the key to the effectiveness of mindfulness therapy. And you don't need to be in the same room with a therapist to learn these mindfulness strategies, but you do need to see each other. So that's why Skype therapy is recommended over other forms of online therapy. If you can see each other, then the effectiveness of communication and your therapy sessions will be exactly the same as meeting in person. So if you're interested in learning about how to work with your emotions using mindfulness and how to break free from the habit of the reactive thinking, then simply contact me and we can schedule an online therapy session via Skype. I work with people throughout North America, also Western Europe, and as far away as Australia and Japan. All you need is a good internet connection. So in the first few sessions together, I will teach you how to work with your reactive thinking. And the way we do that is by actually meditating on our mind, on our thoughts, on our emotions, and we look to see these blind habitual processes at work. Now, a fundamental principle here is that the more conscious you make those habits, the the less powerful those reactive habits will be. So this is how we break free from the habitual reactive thinking that feeds your anxiety and depression, by developing more and more mindful consciousness of those patterns. You learn to see them objectively, very much like being in the audience watching a movie. You know that you are in the audience as the observer watching the movie. You are not part of that movie. You are separate from the movie. So this is an analogy for mindfulness training, how to stay in the audience as the observer and not become swept up into the movie of your mind, all of that blind, habitual reactivity that feeds anxiety and depression. So reactivity has this effect of inhibiting healing. It basically feeds the fire. But when you break free from that reactivity through mindfulness training, then you stop feeding the fire of anxiety or depression. And then you set up the right conditions whereby that emotional suffering begins to heal itself, which it will do if you stop feeding it with the habitual reactivity. So this is a very important principle in all mindfulness training, and it's what we put into practice here during our mindfulness therapy sessions together. It's very effective. Most people see tremendous improvements after the first 3 or 4 sessions. The key is learning how to apply mindfulness so you can do this work at home between sessions. That is what makes the difference. And so if you'd like to learn more, simply reach out to me and let's schedule a Skype therapy session. Thank you.